They quite openly told me, don't tell anyone you're a pharmacist. And I was like, that's a bit of a kick in the teeth. Why is that something to hide?
Hi, everyone, and welcome back to the Clinical Pharmacist podcast. My name is Ruhina, and I'm the CEO of Clinical Pharmacist Solutions. And in this series, we're speaking to pharmacists who are applying their skills in different and evolving emerging areas of practice. One of the themes we've been exploring is how the profession is changing. Pharmacists today aren't limited to a single workplace or career path in the way that they once were. Many pharmacists are now developing portfolio careers, combining clinical practice with education, private services, digital health, or specialist interests. One area that has significantly grown over the last few years is aesthetic medicine. It's also an area that often raises a lot of questions amongst a lot of pharmacists. Some people see it as a completely separate space from healthcare, whilst others are curious and unsure about how their clinical skills may translate, what training is required, and whether it is appropriate or a professional route for pharmacists at all. But when you look closely, many of the core competencies that pharmacists already have, such as consultation skills, clinical decision making, patient safety, risk management, knowledge of medicines, are actually very relevant to this field. So, today's episode is really about understanding aesthetics from a clinical perspective and hearing from someone who has been part of that journey. Today, I have my lovely co host, Sarah Dekmak, with us, and we're really pleased to be joined by Mo Harb, an aesthetic pharmacist, educator, and brand ambassador. Mo has been one of the pharmacists helping to shape how our profession is entering the aesthetics field. And he also spends a lot of time teaching and supporting other clinicians that are entering the field. So, Mo, thank you for joining us today. And to start with, it would be great if you could introduce yourself and tell us a little bit about your background in pharmacy and how you first got into aesthetics.
Brilliant. Well, thank you so much for that kind introduction. It's so lovely to speak with you guys. So yeah, my background obviously as a clinical pharmacist originally, my journey through pharmacy has been up and down, I would say, as most people feel that way. I started off as a community pharmacist. So when I was a pre-reg or pharmacy student, I was sold that kind of community boots dream and was kind of just guided that way. And I thought at the beginning, that's where my career is going. So working my way up through that, and I feel that there is a common theme in a lot of community pharmacists of the element of frustration, that we don't get to use our full potential. We have skills that are not being utilized, and we want a little bit more. I was, I guess, fortunate enough that I've got an older brother who's a plastic surgeon. Now, he's quite a prominent or well-known figure in aesthetics, setting up his own clinic, doing things on the stage, doing all sorts. And obviously, being my brother, I always kind of look up to him in that sense. But I never thought aesthetics was for me. It was never a thing for pharmacists back in the day. I'm talking probably about 10 years ago now. And then as I kind of got more into it, seeing what aesthetics was all about, originally I was of that opinion of aesthetics is all about celebrities, fake results, people looking unnatural, all that kind of stuff. Then I saw what my brother was doing, some of what his colleagues were doing, how it was kind of enhancements and tweaks, and it's still not for pharmacists. Still, we were never in that conversation. Back in those days as well, prescribing was quite new, so I had just done my prescribing, and I moved into GP land, kind of became a GP-based pharmacist. And I actually really enjoyed that role. That was, again, becoming more clinical, doing something a bit different. It was kind of a new phase for pharmacy as well, and I was excited to be a part of it. As things developed, being a prescriber, my brother asked me the question, why don't you do aesthetics? And there wasn't an answer. There's no reason why not. It was just something that's not being done. I thought, okay, well, we can look into that. I looked at foundation courses that were available, and some would train pharmacists and some wouldn't. But you want to still go somewhere quite credible. I don't want to do things as a quick fix or do things in the wrong way, that's for sure. I think our inherent nature as pharmacists is kind of avoiding risk and minimizing risk and being cautious. And we take that to our patients and in our careers. So I found a reputable aesthetics academy that did a one-day training course in foundation aesthetics. Fantastic. came out of that course not feeling at all confident. Okay. Back in those days, again, probably about 19 years ago, foundation training was training on a little plastic head, no kind of hands-on live injecting that you see. Very much the fundamentals and basics of what dermal filler is, what botulinum toxin is. Here's a certificate, off you go. I'm a pharmacist. I've never injected someone's face. And that's crazy, right? That people would just think you're now good to go. So I didn't do anything with that certificate. I spent months just sitting on that kind of qualification or that certification, doing nothing. Again, I was fortunate enough that my brother has a clinic, so I shadowed him. But again, learning from one person isn't enough. That's his way of working. That's his point of view. Now, he was working with some manufacturers or some companies within aesthetics as like a trainer for them. They'd have specific training days, and he would be able to get me on those training days. I thought that was really good. I can learn from other trainers or travel around the country, learning specific techniques and specific products. That was great. And that sounds amazing. That sounds like a really vital part of your training. But on those training days, when I would turn up, they quite openly told me, don't tell anyone you're a pharmacist.
Wow.
I was like, that's a bit of a kick in the teeth. Like, why is that something to hide? Why am I ashamed of being a pharmacist? I don't know the reasons why, but those were the rules. So that seemed to be like an unspoken rule in aesthetics of don't tell them you're a pharmacist. And I didn't. But even though I'd walk away with new skills, I'd walk away with less confidence.
Yeah.
Feeling like I couldn't tell people I'm a pharmacist. Why not? It still doesn't make sense. But I persevered. And for a few years, it was just me being in practice, working in my brother's clinic, but not really advertising the fact that I'm a pharmacist for ages. And I think actually there's been a few people that I've met along the way, a few pharmacists who we're trying to get our name out there, trying to get some credibility to our name that we deserve, because why not? It's all about the wider healthcare team. If you're a healthcare professional, you're a healthcare professional. Everyone's a specialist in their own way. I'm not a mini doctor, and I'm not trying to work my way up to being a doctor. And I feel like, especially in aesthetics, it had that quite old-fashioned hierarchy of doctors and surgeons at the top, and others were kind of clambering their way to prove themselves as good as these people. But I think things change, mentalities change, and over the last 5 years especially, there's been a big attitude shift. Patients never seem to mind. I've never had that problem from patients. It was more within the industry. Other training academies, now training pharmacists and so on. And I was at the point where probably about 4 years ago, I was faltering. I was like, do I stay in this industry where I'm not wanted? And I was questioning it. Like, what's the point? Like, about 4 or 5 years ago now. It's been a long time. COVID times. Yeah. It was during COVID where the whole industry settled down. I thought, when we come out of it, do I want to be in this industry? You know, it's a bonkers place to be. But we pushed, we persevered, and actually, I made up my mind that I'm going to wear my pharmacist's badge with pride. And whatever happens will happen, because that's the only way you can be your most confident self, rather than trying to be something you're not or trying to hide something. You be the most confident version of yourself. And actually, it's worked very much in my favor. Now I go out and I'll speak to different companies, different manufacturers as a pharmacist, and it has its own weight to it. So I think, as you very kindly mentioned in your introduction, I work as part of a training academy called Aesthetic Intelligence, based in London. I'm a brand ambassador for Vivacy UK. So they're a French brand who make dermal fillers and other products as well. And I'm a KOL now and a trainer for Filmed, another French brand training in their biostimulators and skin boosters. So going from don't tell them you're a pharmacist to them now putting the pharmacist on a platform has been a really nice and refreshing change to see. So it's been a bit of a journey, I'd say. And sometimes you don't realize how far things have changed until you kind of take stock of where you were to where you are. So it's been a push. There's still loads of work to do. But even in GP land and everywhere, we're always the sidekick. The pharmacist is always the help. And I think we just
Yep.
need to
Change that.
let's just change that and just take those almost like shackles off. We're always the help in hospital. We're always the extra one in the GP land. We're just like, what do you mean? We studied a long time to get here, you know? You think?
Exactly.
Yeah. So yeah, it's about just kind of knowing your role, knowing your specialty, that we have a lot to offer. And I feel like it's being more recognized now. I think it's just all about just owning that title of pharmacist. I think
Yeah.
that's what's kind of owning that with confidence has got me to where I am.
I think you've said so much there that Mo that I just want to unpick, and I think it's like really exciting conversation. I was really excited to actually have you on the podcast today because I think you're a huge advocate for pharmacists that are working in aesthetics, and I can see how your journey has developed over time. And I think one of the things that Mo once told me, so I've worked with Mo in terms of a little bit of aesthetics, but once upon a time, I would remember getting a pair of scrubs, and my original scrubs said aesthetic medicine on them. And I said to Mo, what should my scrub say? And Mo was aesthetic pharmacist. It was like, be proud of who you are, be proud of being a pharmacist and showcase what pharmacists can do. And yeah, there has always been that little bit of apprehension to say, should pharmacists be like in this field? Should they be actually doing aesthetics? And I think if you look at our background, we're specialists in medicines. We know physiology, we know how drugs work in the body. I think sometimes there's a bit of apprehension around anatomy, and that's something that we really need to kind of learn as pharmacists. It's something that I feel that is really missed. But courses such as you've said, like your aesthetics intelligence will be really useful for pharmacists. I think early in the day, I think 2017, 2018, I remember I was also in a similar position and I was looking at foundation injectable courses and nothing was ever tailored to pharmacists. So I think it's really exciting what you're doing and how you're supporting because actually it's led the door to be open for pharmacists that are actually wanting to do these courses. And no, we're not nurses, no, we're not doctors. We have got a completely different niche of skills and we've got a different learning criteria that we need to be confident in these roles as well. So as you mentioned, one day is not enough. You don't feel confident to go away and be able to do it. What advice do you give to pharmacists that are kind of stuck in this position? They've done that foundation day or a couple of days, they've had a couple of supervision sessions, and they're still standing there feeling, okay, I have no idea of what to do.
That's exactly right. And part of my role in the training academy was to draw on my own experiences. And we wanted to do things differently. It's not just about theory. Anyone can read a book. Anyone can pick up a document and learn something. Easy. I think honestly, the dream of the aesthetics world can be misunderstood. People think, it's going to be amazing. I'm going to learn a few injections. It's super easy. I'll need to work a lot less and I'll make so much more money. I'm going to have that work-life balance. A few months down the line, I'll open my own clinic. Oh, amazing. It does not happen that way. It does not happen. And that's not the only route. I think you've got to be realistic about your time. You've got to be realistic about your knowledge, about your expectations from it as well. You can't always blame the industry. You've got to reflect. That's my personal point of view. I think training-wise, you've got to invest. Aesthetics training, it builds up. It's expensive because there's so many things you need to do. It's not just a foundation day. There's things that we offer like supervised practice days where you get basically a clinic day. We get 5 or 6 patients just to yourself after you've done your foundation. That throws you in the deep end. You consult, you assess, and you plan and you treat. We'll have someone there kind of supervising you, but this is you. This is the real world. It's not that easy. Patients are not as straightforward as maybe in community pharmacy, where it's a prescription. It's written in front of you. Is this or that? GP land twisted that a little bit. There's a bit of diagnosis involved, but you're following a framework. You've got your nice guidelines to refer to. You've got the pathways to refer to. Aesthetics is a whole new skill set. It does add the element of kind of creativity and subjectivity to every single consultation, every single patient. I think people need to just chill and not expect too much from aesthetics. If I was guiding someone getting into it now at this stage, I think the biggest thing I would say is one, your training is important,
Mhm.
but two, I don't think there's any shame in working as part of a clinic or part of a team. That makes a lot more sense to me. Running a
Yeah.
clinic is its own job. It's a full-time job. I wouldn't recommend it for everyone. Not everyone wants to open their own pharmacy. Why would you want to necessarily open your own clinic? I think have patience with it, have patience with yourself. It's not an easy thing to do. It is fun. I'm not gonna lie, really fun. And it does add a new element to it, and you can add a bit of personality, you can add your own style to things. It does seem like it's its own different arena, and it can be really overwhelming to start with. Start slow, start with the basics, do simple treatments and do them well and do them often. That's the key. Yeah. Do the essentials really, really well, really, really often before you start layering up, before you think, oh, there's so many like different devices, different products, different treatments, different trends that you have to sift through to get to the core of it. So use that pharmacist brain and don't try and be something else as well.
So I think, Mo, there's a lot of pharmacists that will go ahead and do the training. So I've actually got a couple of questions here. So a lot of pharmacists will go ahead, they'll do the training, say, okay, I've done my foundation, Botox and fillers, and now I want to go and do my clinic. And sometimes that can be a little bit over ambitious. And there's loads of different things that you've had to think of, from marketing to client retention to lead generation to media to social media. There's so many different things. So I think people can go in thinking, yes, I've done my training. It's going to be amazing. I'm going to hit the ground running and I'm going to have a million clients come to me, and I'm not going to be working in community. I'm not going to be working in GP. And I think that's sometimes a false kind of ideology that they've got, and they go in all guns blazing and then sometimes get a fear of that failure and then just step away and completely forget that they've gone in to do aesthetics in the first place. So I think it'll be great to hear a little bit about your journey in that aspect, to see how did you start? As you said, start slow. What
Yeah.
advice can you give people in that sense? Because I think it's not just that one core skill that they're learning. They're learning things like lead generation, they're learning marketing and media. And these are all things that, as pharmacists, they're not packaged into our degrees. So it does, I keep saying this, it takes blood, sweat, tears, time, and you are constantly working. We see you at these events, and we've seen how busy you are from jumping from one training session to another training session. But it takes some time to get there. So what advice could you kind of give for those?
I think what's important to realize, don't believe everything you see on social media.
Hmm.
That's a key point.
Yeah.
Okay. I've been doing this now coming up 9 years, and it's still has its peaks and troughs.
Yeah.
I think you need to remember, anyone getting into it, you're not alone in that feeling.
Hmm.
It's everyone starts off. My my journey in aesthetics for the first, probably I would say about 3 or 4 years, I was practicing 1 day a week. I was doing Sundays as aesthetics, and then 5 days a week I was doing pharmacy work.
Hmm.
That's how you build it up. You don't just drop your job and think I'm going to work 5 days a week and think I've got a foundation so people will come. No, there's plenty of injectors out there. You will find your own niche. You will build it up slowly. You'll build up your experience slowly. Or you might get lucky, fine. Find the right resources. There are events that everyone should go to just for the idea of exposure. Talk to people. We are so used to working alone as pharmacists. Yeah, in community pharmacy, you're usually on your own. That's what it is. GP pharmacy, you're on your own. It's not like that. It should be a collaborative thing. Network with people actually probably made the biggest difference to my journey. Just getting to know people will change your way of thinking, giving you new ideas. Finding the right resources is difficult. It is difficult. So you've got to be able to have a bit of intuition and realize what's good and what's not so good, what's trying to spin you an idea or is just pure marketing and what is actually core knowledge. It is a bit of a journey. And like I said, I've been doing it this long. Only, what, a year and a half ago, I went full-time aesthetics. And that's my clinics and my AI aesthetic intelligence training and working with other companies and brands. That's across 3 different roles that makes up a full-time role. So clinics, it's a very competitive market. So don't have kind of delusions of grandeur that you're going to take over the country and be the best esthetician ever. Chill. Work. There's no shame. There's no harm in working in your little locality, finding your little niche. That will be more than enough to get things ticking over.
Yeah.
It's not the social media dream. It's not Instagram, everything.
Yeah, I was going to say, I think everyone looks on Instagram and sees like the influencers, probably thinks, I want that. I mean, are aesthetic clinics hiring pharmacists directly? Because obviously, not everyone's going to be able to just open their own clinic, like you said. If they did do all the training and they did some sort of shadowing days and then the hands-on days with patients, what would be the next step? I mean, are jobs widely available? Do you know?
That's a bit of potluck, unfortunately.
Yeah.
Yeah, there's no kind of rhyme or reason to it. It's not the most kind of structured industry in general.
Yeah.
There's so many things going on. Pharmacists, we're small fish at the moment, especially in aesthetics, with regulation constantly being talked about and constantly changing, with non-regulated people completely doing aesthetics, offering kind of bargain bin prices for your
Yeah.
Botox. That's another issue. So yeah, there's so much to kind of sift through. But in short, yes, people are hiring pharmacists.
Okay. That's good news.
Yeah, they are. I would hire pharmacists.
Yeah.
I know plenty of clinics that have pharmacists as part of their team. There are now starting to emerge more pharmacists as trainers for certain companies. So just for example, for FilmEd, I'm a pharmacist on their faculty, but I'm not even the first pharmacist. There's another lady before me. So it's good to see that actually they're being recognized as clinical trainers and clinical educators. But I just don't think it should be a barrier. That's the only thing. Before we kind of put these barriers in place on ourselves, thinking I'm not going to go for it because I'm a pharmacist. Just put yourself out there and see what bites. But ultimately, what comes with aesthetics, really, you've got to have a bit of character, a bit of personality. We're not all the same.
So
No.
I think there, Mo, I feel like I've just got so many questions for you today. So I've got 2, and I'm going to say these both before I forget them. So actually, number 1 is there's a lot of different companies that offer training. And as we've mentioned, a lot of them aren't specifically for pharmacists. And there's going to be pharmacists out there that are seeing a lot of misinformation. And I think what we want this podcast to do is to make sure that if pharmacists are doing this, they're doing it via the correct routes with the right information and learning from experiences that we've had in the past. And I think you're in a really good position to speak on that. And I think you always see like these expensive level 7 courses, or you see the starting courses for foundation. What advice would you give to pharmacists? Because I think there's a lot of people that don't know where to start in terms of education for getting into the aesthetics field. So that's one of the questions that I want to ask you. And before I forget the next one, just because we've just mentioned we're a very regulated kind of profession, as we should be as pharmacists. But in terms of aesthetics, I think we're seeing a whole new niche, and people aren't being able to understand. Number 1, pharmacists are coming into the sector, and they're very well skilled and placed to be there. But I think there's not been much infrastructure around kind of the regulation. And I think aesthetics, there's been a lot of conversation about the regulation of healthcare professionals doing it, but you've also got people working in salons that are like being able to administer things like Botox and fillers. And I think healthcare professionals, of course, are in a really good position to be able to do these in a regulated manner. But at the moment for pharmacists, there is a lot around what indemnity insurance needs to be in place. And I think it throws a lot of pharmacists about what they should be doing and what is correct for them and what regulations they need to do. A lot of them are probably thinking, I want to do these courses and then have a kind of a home setup or have my own clinic space, but there's a lot of regulations. So yeah, what advice would you give to those pharmacists? Sorry, two really meaty questions
No,
that I've asked you.
As we said previously, we are quite risk averse by nature.
Mhm.
And I think that works in our favor, that we're only going to do something if we do it properly.
Yeah.
So you've got to ask the right questions and you've got to ask the right people.
Mhm.
It's not just winging it until something happens. So I consider myself, I am in a fortunate position, but I'm not gatekeeping any information. If people want to know, ask. And
Yep.
when I wanted to know, I'd ask. You can ask. The regulators themselves are starting to catch up. Aesthetic medicine, aesthetics procedures are now being mentioned in our kind of regulatory body. It's there. You want to open a pharmacy now. The form says, are you performing any aesthetic procedures? It's a thing. So it is being recognized more and more. But the regulation around aesthetics in general is just a bit vague. It's not exclusive to us, which is why we've just got to use a bit of logic and use our own understanding of safety and risk management. And we're all about regulation. We are the regulator within every healthcare practice that we go to. We stop everyone else from making mistakes. That's our job.
Yeah.
Mhm.
So we can't forget that. And we can't kind of just ignore that when we're doing our own businesses as well. Really, it's just, yeah, just ask any question. There's no silly questions. This is the point about remembering you're not on your own in this. Other people have been through this journey and probably still have the same questions. And there's no way I'm going to pretend that I know everything. Absolutely not. And anyone who does pretend they know everything, they're probably the ones to avoid.
Mhm.
That would be my kind of advice. No one knows everything. People have bits and bobs. I haven't set up a clinic in a pharmacy, so I couldn't tell you exactly step by step how to do that. But I can tell you what's required to set up a clinic in general in a safe environment. And a pharmacy is a regulated premises. So you've already got lots of regulation going on there. Doing it at home, that becomes a different story because you're a regulated person working in a non-regulated premises. How does that work? There are lots of questions to be asked. And the thing is, because there's nothing set in stone, there's no one way of doing it. So you've got to just ask the right questions to the right people, have, a good network of people. I wouldn't rely on just my brother for everything. Absolutely not. We've got a much wider team. You ask the manufacturers about their products, about the safety of their products. You want to ask every training academy about their approach and is it evidence-based or is it just from our experience or we think this is the best way of doing it or you know what, this is a checkbox exercise, we'll get you signed off in the quickest way. There's loads of different approaches from different academies. There's a little bit on you to really start recognizing that it's not always an external thing you need to rely on. Some of it's got to be from you. What was the other question?
I knew you were going to say
Is that right?
But I shouldn't have asked too many questions all at once, should I? Needed to get it out the system before I forgot. So the other question was relating back to training and the different training packages from quite a few different providers. So as we mentioned previously, they're not always targeted at pharmacists, and there's a lot of
Yeah.
information about these courses. So like I mentioned, you might see like a level 7 or a foundation course. And for those pharmacists that are looking to get into the field, I think there's a lot of information overload coming from a lot of different places, a lot of different like academies or training
Yeah.
hubs. Or what advice would you give to these pharmacists? What would you look for specifically?
You look for how much confidence have you got in those people?
Mhm.
How much confidence is that going to give you training with this person? The kind of resources that they are using and that they are providing matter.
Mhm.
In regards to level 7, when I did my foundation, I was told level 7 is going to be like mandatory any day now.
Mhm.
Any day now, everyone has to do a level 7. And I fell for it. I did the level 7.
Still not mandatory.
With all due respect, it's rubbish.
That was about 8 years
It's
ago.
not even detailed. It's not that detailed compared to other courses you can do anyway. It's not mandatory. and it's very expensive.
Mhm.
And unfortunately, there is a lot of hype around it. And I'm not saying it's completely useless, not at all, but it is a very valuable source of learning. But one of the things that was a bit of a bugbear was that it's sold, level 7 means a master's equivalent qualification.
Mhm.
It's not true. That's simply not true. There's a colleague, a pharmacist colleague called Gillian Murray, who I would recommend everyone follows. She's working in the aesthetic space, very much in the educational side of things. And she does a lot of research into basically a lot of the rubbish that's out there. So she's a great resource and I have a lot of respect for her. So she talks about this kind of misrepresentation of the level 7.
Mhm.
And I think that happens a lot. There's a misrepresentation, there's the overhype,
Yeah.
which is easy to fall for. So aesthetics as a field, as a general kind of powerhouse, is a mix of healthcare professionals being grounded in their ethics and their practice, but then having that hype, that Hollywood hype and marketing and blah, 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 and all the lavish stuff that we do. And there's a mismatch. These two things don't really go together. So
Yeah.
it's hard. It is hard to sift through that stuff. And that's one of the things that we've honestly, especially at our training academy, trying to avoid the hype. We have tried to build our courses fully on evidence-based kind of techniques and safety protocols, and also our own experiences from good training and bad training. What did we like? What did we not like? I didn't like my foundation at all. Came away feeling less confident than someone who went in knowing nothing. How can I be less confident? Doesn't make sense. So don't jump for the first thing that you see. Don't go for the biggest, most brightest thing, but ask the right questions. And you are absolutely entitled to ask questions. We are not in the shadows of anyone. This is your training. This is your career that you want to forge. So absolutely, you need to be 100% confident that this is going to work for you and that you've got the right resources to hand, that when you go into practice or go into clinic or when you're speaking to a patient, you think, yeah, I've got enough grounds here to be speaking to this patient confidently. I know how I'm going to assess them, and I know enough knowledge about my products and my techniques to answer any questions. So yeah, it's all about building your confidence, essentially, and your competence.
Yeah, so I think you've touched on some really important points there. So it's about actually doing your research,
Mm.
finding out what actually works for you. It's not jumping at the first thing that you see and saying, okay, this says that it's for pharmacists. Everything that we see on the tin might not necessarily be what you get. So it's really important that you actually look into that. Mo, if pharmacists wanted to be able to access your training at Aesthetics Intelligence, where could they go to access that?
So the best way to reach Aesthetic Intelligence has our Instagram and our website. Okay, so aestheticintelligence.co.uk is the website, Aesthetic Intelligence on Instagram. Or you know what? If you're a pharmacist specifically, you have questions, reach me. So it's just Mo Harb Aesthetics. Easy. I get questions all the time. That'll be the easiest way, just to ask the right questions. And hopefully, and I'm confident that we will be able to answer them in a way that will give you the confidence in us. That's the best way. Our training academy is based in London, but we also have lots of online material because it's important that it's not just a 1 day training. It's stuff that you take home and make your own notes and take your own learning and you can refer to. There's no harm in that. That's the thing that people need to remember, having the right resources.
Definitely. And I think you mentioned something earlier that actually it's about having a network of people. And I think over this series, we've been speaking to a lot of different pharmacists that are doing exceptional things. And everyone has always mentioned that they've looked to a mentor or they've had a network, and this has been able to really support them through their journey. Is there any networks in particular that you might recommend to pharmacists that are joining the aesthetics field?
I mean, there's not one for pharmacists, but
Mhm.
that's something we're working on.
Yep.
So there's an aesthetic pharmacy group that we're working on
Mhm.
because all the other kind of disciplines have one. The
Yep.
doctors have one, the dentists have one, the nurses have two great ones, but we pharmacists have nothing. So we're trying to build that because we all feel the same way. This is the problem. We all feel the same way, yet we're still all so isolated.
Yeah. Yeah. So it's
There
exciting,
are a
Mo.
couple of like WhatsApp groups that are out there. So people are interested in kind of just joining those discussions, seeing the kind of questions that people ask. There's no silly questions, as basic as it might be or as advanced as it might be. Don't be fooled by the word advanced. Everyone is still learning. Everyone.
Yeah.
And there's no shame in that at all. Whatever stage of your career you're at, we're always learning, especially in a field that's always changing.
Yeah, absolutely. I think, as you've said, Mo, like it's really good to be able to get your advice, and you're someone that we've known for quite some time, and we know that you don't gatekeep with this advice. And that's probably one of the reasons why we thought it was really exciting to have you on this podcast, because you're full of knowledge for pharmacists and you're always willing to support and help those pharmacists that are looking to kind of get into a career of aesthetics. Before we wrap up, Mo, is there any advice that you would give to pharmacists that are just stuck and they're thinking about, I've got an interest in aesthetics and I really just don't know what to do next?
That's easy. The next step is aesthetic intelligence. Simple as that. But really, it's about, honestly, I think question your own motivations.
Yeah.
Why you want to do this? What's the real reason you want to do it? And have the right expectation there. And if there's that little seed, that little bug in you that's just asking, what's it all about? Just find out. You don't have to do a foundation course to find out.
Yeah.
Just get yourself into it, immerse yourself into it. In fact, next month there's the aesthetic conference in London as well. That's free to attend. Go and see what it's all about. Get to know other practitioners, attend some of the talks, see the manufacturers. That's the only way to find out. Instagram is not the way. It's not the only way, at least. But no one really says the full truth on Instagram. Instagram is a marketing tool. Simple as that. So there's a lot more to it. There's a lot of reality to it as well. And speak to people. I speak to people almost daily who are new to this, whether they're pharmacists or not. And there's a pattern of questions. So you won't be alone in whatever you're feeling. But if you have that bug, get out there and ask.
Brilliant. So thank you, Mo, for sharing your experience today. I think one of the key takeaways from this conversation is that aesthetics isn't really about stepping away from healthcare. It's about applying clinical skills in a different setting and making sure that patients are seen by a highly skilled clinician who knows the anatomy, who knows the physiology, and knows the background of the products that they're using for the patient. I think as pharmacists, we're trained to assess patients, manage risks, communicate clearly, and prioritize safety. And what's become clear from this discussion is that those skills are actually central to good aesthetic practice. So it's been helpful to understand the reality behind it. And like any area of practice, it requires proper training, supervision, time, and patience. I think it isn't an overnight career change and it isn't simply a social media trend. It's a clinical service that carries responsibility. I think the aim of this podcast isn't to encourage everyone to go and change their career paths, but it's to help pharmacists to understand the range of opportunities that actually exist and make informed decisions about what might suit them and be guided by someone who actually has the knowledge to be able to give them that advice as they've gone through the experience. So, Mo, thank you for taking the time to speak with us and for giving us such an honest insight into your experiences and the field. And thank you to everyone for listening. So, if you've enjoyed this podcast, we'll continue to speak to pharmacists that are working in different areas of practice to explore how the profession is evolving and where it may be heading in the future. And we look forward to seeing you in the next episode. Thank you both.
Thank you.